WCLN 1170 Radio and Star Vision Cable Channel 16 are pleased to present We Should Know, hosted by J.W. Simmons, an upbeat, informative look at people, places, and issues facing our community. This education-based analysis of issues will remain positive and informative as we consider closely what we should know.
Ladies and gentlemen, welcome back. The name of the show is We Should Know. We're coming to you on WCLN 1170 AM radio. Of course, Star Vision TV and Star TV, both. I think a lot of folks out there have Star TV. If you have Star TV, you're watching us on Channel 16, and Star Vision, Channel 16 as well. So we appreciate you looking and listening to us today. As we move forward, I also want to remind you that this program is summation of it is in the Sampson Weekly newspaper each and every week for your review, and it is a summation. I also want to remind you that if you happen to miss the show, there's a replay Tuesday, Wednesday, and Thursday at 7 p.m. Also, shout out to all of those folks that listen to the show, the people that email us, give us content information, what they thought about the show. Paul Holscher last week, the attorney that talked about the National Health Care Plan, what that is and how it's impacting. Many of you have already contacted us and let us know that you saw where there have been some changes in that and the extension of that program as it relates to some of the business with 50 or more employees. So we appreciate your comments and also your suggestions of shows and things that you would like to hear more about. One of those is our guest today. Many of you have talked to us about the whole issue of chiropractic care, and we have a number of chiropractors here in the area. One of those folks have decided that they would be willing to sit down and talk to us about that, give us some information about what chiropractic care is and the profession of chiropractic. Dr. Marianne Luxter. Marianne, thank you for being with us today. Thank you for coming in and taking time to chat. Let's talk about chiropractic and what that is. The word itself is a little bit different than what we hear with other medical kinds of things and professions, and there is some specific differences in that. Back in the late 1800s, D.D. Palmer started out, and there was the words that was involved with him included everything from magnetic stuff right on around. So how about if I just let you just talk to us about the history of chiropractic care?
The history of chiropractic care is something that fascinated me even before I decided to become a chiropractor. In fact, I entered into the chiropractic profession later on in life. I had already gone to college. I studied physical therapy assisting. I decided to get married and start a life that way, and then I hurt my back and decided to go to a chiropractor myself. And then I started doing some investigating on it and decided that this sounded like something that I really wanted to pursue. So the history behind chiropractic starts off even going back into ancient Egyptian times, where the medicine of then is not the same medicine that we have today. So they looked at things of the spine as far as the spinal cord goes and how to help with health. D.D. Palmer, coming from Canada, actually settled in Atumbo, Iowa, and as the story goes, there's actually two stories behind it all. There was a janitor in the building that he was working in and was talking to him about how he couldn't hear. And the history says that it was because he was working in a cramped space and he heard a pop. Well, D.D. Palmer, being someone who was interested in anatomy, examined the man, found that there was a misaligned vertebrae in his body, then gave an adjustment, or what is considered the first chiropractic adjustment, and slowly Harvey Lillard's hearing returned. The word chiropractic comes from two Greek words, kairos praktikos, and that actually means done by hand, because we look at the spine and relationship and health as far as how can we help this person with our hands. And that's the basic history behind how it all got started. The first chiropractic adjustment was on September 18th in 1895, and it has grown into this profession, which is it is the fourth leading medical profession in the United States today.
You know, and the interesting thing about chiropractic care, it's had somewhat of a bumpy ride back in the 1800s, even up into 1995 in the 90s, and then in 2005, I think the World Health Organization came into effect and basically gave it a little impetus of what it really was and set some standards on education, training, and those kinds of things. But there was another part of that history that's important, and that's the other kind of care that's in there, the endoscopic care, that kind of thing. What are the differences between those two kinds of things?
The main difference is one looks at blood as the cause of disease in a body. That's the osteopathic program. They're looking at the blood content. Chiropractic is looking for a relationship on a pressure on a nerve. Since the entire body is controlled by the nervous system, the brain has the skull to protect it. However, the spinal cord, the extension of the brain itself, has 24 movable bones that rotate. That's how we get our motion. That's how we twist and we turn. And that spinal cord, then, like the cords here in this office, or your computer system, for example, your mouse, even though we have a mouse that is wireless, before we had the wireless, it had to be connected to the computer. The computer of your body is your brain. For that mouse then to communicate, it had to have a connection. And that is the nervous system in your body. So with those 24 movable bones, if you're looking at pressure on a nerve, then now you've got miscommunication to where the brain wants that nerve impulse to go to, and therefore possible disease or misfunction is then occurring somewhere within the body.
So let's talk about this education and training a bit. You just mentioned, you had your basic college curriculum stuff taken care of, and you decided you wanted to go into the profession of chiropractic care. What are some of the kinds of things that you had to get involved in, and what are some of the curriculum stuff that you got involved in as it relates to chiropractic care that may differ specifically from a lot of the medical profession that we look at as it relates to internal medicine, of where you're prescribed medicines and drugs for various things that interacts in the body and does things? How does chiropractic care kind of go in a maybe not necessarily a different direction, but in another focus rather than the folks that are in medicine or internal medicine?
The prerequisites that's necessary to go to a chiropractic school are very similar to those that are necessary to go to a medical school. Both require the pre-med anatomy, the physiology, the chemistries, the biochemistries, the biologies. That is the same. And once a person graduates with a pre-med or a bachelor's of science per se, then any person then chooses which avenue of care they want to go into. For example, a medical doctor, once they've graduated, then they decide to continue on with medical school. A chiropractor, when they've graduated or they have their prerequisites maintained, then they decide they're going to go to chiropractic school, and that's where the difference actually is. It's decided upon which college you wish to go to. Same with someone who has a doctorate in the other medical form, the DO, for example. Then they go to a college that specializes in that. That's where the training separates. Where in medical school, they've got great training in the medications that's necessary, the exams, the physical exams, radiology, and so forth. Chiropractic, we concentrate mostly on radiographic findings. There's 5 classes in x-rays that I have to take. There is diagnostic classes I have to take. The anatomy and physiology, the dissection classes, that's all the same. But we concentrate more on the chiropractic, the adjustments that makes it different.
So when we look at certifications, does each state have different regulations, or is there a national certification?
There are national certifications, and then there are state certifications. Each state governs each chiropractor in the way that it wants to. For example, I went to school actually in Davenport, Iowa, which was the original chiropractic school started by D.D. Palmer that we first talked about. But I had classmates from all over the United States. So they had plans to go back to Michigan. They had plans to go back to Washington State. They had plans to come elsewhere. So Michigan, for example, only requires, at that time, 3 national board exams. North Carolina required 5 national board exams and higher scores. So each state then governs. I had classmates that went to Washington State. They are allowed to do small surgeries. Other states, they're allowed to do, like I said, removing moles and so forth. North Carolina, I'm not allowed to do physical exams for sports or for DOT. In Ohio, my license did allow me to do those type of exams.
So North Carolina then, based on what I just, if I heard you say this correctly, has some of the most rigorous requirements of other states.
It is one of the high, yes it is.
What do you find when you look at the curriculum and what you've been through and talking to other folks in the medical profession, is the challenges you faced equal or more or about the same as other medical professions?
Challenges as in
as
patient
it relates
care?
To academic, as it relates to academic challenges to accomplish the degree to be able to.
I would say it was different but the same. It is less competitive in chiropractic. It is very competitive in med schools. You want to make sure in the medical schools that you're getting the grades to get your internship. The internship is part of my education, therefore it was less competitive. In that aspect, it was different. But the education required, the degrees, the grades and everything, I would say would be the same.
So you look at the academics and you look at the rigors of obtaining the certification, and those certifications are in place. Are there ways that folks come in and examine you as a provider and look at records and say, you know, this person's doing a good job, kind of like the state health boards and those kinds of things in other professions?
Not that aspect, no, but I have insurance companies that will periodically have an audit of my books to make sure that I'm billing correctly, make sure that I'm within the North Carolina guidelines for taking care of patients, so that, I mean, there's North Carolina guidelines to make sure I am not overstretching a patient visit, that I refer out when necessary, so that I do everything to the best interest of patients.
So it's focused on patient care and the result of patient care as it relates to each chiropractor in the state.
Correct.
So when we look at that, the dynamic of chiropractic takes on a whole new light for folks who may be listening. What I want to do is kind of explore that as we come back from break and talk a little bit more about it. Ladies and gentlemen, we're going to take a break. We're talking with Mary Ann, Dr. Mary Ann for you. We'll be back in a moment to talk about chiropractic care. Thank you very much. Ladies and gentlemen, welcome back. We're talking with Dr. Mary Ann Luxter. Mary Ann is one of the chiropractors here in the area, and we're talking about chiropractic services. The part of that we maybe don't understand that much, she was explaining to us the history and education. Dr. Mary Ann, thank you for being with us today and taking your time. We've talked a bit about the education and things that you went through to offer chiropractic care here in the area. Let's talk about that whole issue of chiropractic care as it relates today, as chiropractic care as it relates to medicine today. There's oftentimes you will hear folks, and I know you sometimes get this, people will say, well, that's not really part of mainline medicine. It's not, you know, it's still kind of looked at maybe as not part of what somebody has a problem, they'll go to an internal medicine doctor, or maybe they'll go to a specialist surgeon or something. Where and how does that fit, and how do you explain to people, well, look, we can help you without, you know, dosing yourself with medication or without going to, you know, have something cut on. We may be able to help you with that. Explain to us how that fits and what kind of relationship you have with the other medical professions here in the county.
That's a great question, and it also goes back to my history prior to becoming a chiropractor. I did not grow up in a chiropractic family. My uncle was a pediatrician, and I'll be honest with you, that's the way I grew up. My penicillin when I was younger, when I had the cold, flus, and so forth and so on. It wasn't until I actually hurt my own back that I even understood what chiropractic was. So when someone comes up to me and says, you're just a chiropractor, I understand where that person is coming from because I was in that same spot.
So you don't take that as an insult by any means?
I do not.
It's basically an education thing.
Exactly, because people don't understand what chiropractors do. Chiropractors are something that people are like, they're going to hurt me. What do you mean you're going to move bones? What do you mean you're going to adjust my spine? We use a vocabulary that is so foreign to the general population that I completely understand when somebody says, oh, you're just a chiropractor. And it's like, okay, I got that. then there's that person that will say, I'm never going to a chiropractor, and I was there as well. But when you understand how the whole body is put together, and how the body and the function of our body hasn't changed since God created it. But at the same time, too, there is no inspector as we get made. Everybody is made individually. Everybody has different nuances that makes us even more unique than our fingerprints do. When I moved here to North Carolina, I decided I wanted to work with the medical community. And so I reached out to the medical community, and I actually have the medical doctors referring patients to me. I had a few this morning in my office that a medical doctor referred the patient to me or was calling to make the referral. You don't have to have a referral to come see me from the medical doctor, but in Clinton, I've worked very well with them. I see patients from pretty much all of the medical doctors here, and I respect that. And if I'm not helping their patients, then I will get them on the phone and I'll say, Dr. So-and-so, I'm referring this patient back to you because what I'm doing isn't helping. And we work with that. How chiropractic differs from the medical doctors is if it is a pinched nerve, it's as simple as if you've got a car sitting on grass, grass is not going to grow under those tires. You can sprinkle around it, you can fertilize all around it, but nothing is going to get that grass to grow until the tire is moved off the grass. And that's where chiropractic comes into play. If it's a pinched nerve, something has to relieve the pinching on the nerve. Medication is great to alleviate the symptoms, but it's like that check engine light on your car. It doesn't mean tape it over and ignore it. It means find out what's going on in the car because there's a malfunction. So pain is a symptom that something is wrong in the body. If a medical doctor has done everything to make sure that there is nothing there that is a disease, then let's find out what's causing the pain so we can alleviate the symptom of pain.
We also get the question quite often, the difference between what you do and what a physical therapist does. And you have folks that will say, well, you know, I can go to a physical therapist, or maybe I can go to somebody and have a massage done or something. Give us some idea of what the specific differences are between what a physical therapist is and what a licensed chiropractic doctor is.
Physical therapist has different levels. Physical therapist, you have a physical therapist assistant. That's what I went to school for right out of high school. Then you have a physical therapist, and physical therapists are now getting doctorate degrees. So they are evolving just like chiropractic is. The difference would be in the education behind the adjustment, the mechanical adjustment. I spent 15 weeks in class learning the setups before I am even allowed to attempt doing a physical adjustment to someone's neck. Physical therapy is great for rehab on somebody of knee replacements, strokes, hip replacements, shoulder replacements. Physical therapy is phenomenal at being able to do the rehabilitation programs of that realm. Chiropractic differs in our approach to adjusting the spine. We are allowed to do physical therapies, or we call it physiotherapies, where we can do the same therapies of relaxing muscles, relieving inflammation with electric stim or ultrasound. The difference then between massage and physical therapy is chiropractic is the nerves as they exit the spine go through the muscles and then go to your skin. That allows you to let you know if you had a sunburn or an ant or a crawling on you or a paper cut. Sometimes muscles go into spasms and put pressure on a nerve. So massage is very comparable to chiropractic because it might help alleviate the pain as well. So the two work very well together. All three professions together can help the patient, and in my opinion, to be honest with you, when I work with a medical doctor, when I work with a massage therapist, and when I can work with a physical therapist, then the common goal of getting a patient to better health and out of pain is reached.
Do you have folks that come in periodically, and you, as you said, sounds like you've had pretty much all the questions, that come in and they look at you and say, well, look, I'm not really sure that this is where I need to be, and you can sense that there's something there, and then they allow you to treat them, and after a few weeks or a few treatments or what have you, they change their whole focus, or do they still, if they have a negative mindset, do they maintain that negative mindset?
They usually will change their mindset because it goes back to that education of that patient. They didn't know what a chiropractor did. I was their last-ditch effort to get them out of pain. Now they know what a chiropractor does, and now they refer their friends and family in. Or I'm now seeing their children for issues, or I'm now seeing their neighbors and so forth. So they usually will change their mindset and then stay into the office and onto a wellness program of just maintaining the health that they received, if that is what their goal was.
If we look at one of the things that you mentioned was the manipulation of the spinal column and so forth, and even in the neck and those kinds of things, very crucial. I mean, folks will, you know, I'm sure listeners out there and viewers will go, wow, you know, that's really sounds dangerous, and that's something that could be very crucial, and of course you just pointed that out. The training and speciality in that, is there a tendency that folks maybe hesitate because they think of how fragile that is and they're not sure that they want somebody attempting to move that around? Is that a scary point for folks?
It's a very scary point, and I actually have a point of agreement on them with those patients. That's why in my office we also use an instrument to do adjusting. I don't always have to use my hands. If a patient doesn't want their neck or their low back or manipulated, or their child manipulated with their hands, I've got a machine in my office that is very comfortable and very computer accurate, that I can use a machine to adjust somebody's spine and get the same results.
So when we look at that adjustment and looking at where we are now and what we've just talked about for our listeners to kind of bring this to some focus, we're really talking about the adjustment of the spine is one of the key focuses of chiropractic care.
Yes, yes, it is.
So if we look at that as the key focus, then that sets you aside as it relates to other forms of medicine or medication, or even manipulation is the word you use, as it relates to therapeutic or massage, those kinds of things. Are there times that you have patients and you look at the spine and you kind of see a situation and you go, this is not what I need to do, or do you attempt to try to help a little bit anyway, or do you just kind of say, I don't want to get into this? Talk to us about that.
I do get into that with patients. You know, everything in life is a cause and an effect. If you're standing in the shower and you notice you're ankle deep in water, there's a reason why. There's a cause and effect. And sometimes I have patients that just aren't responding. That's when I get on the telephone to a neurosurgeon. There are 2 neurosurgeons that I work with, actually 3. And I don't have a problem giving somebody a phone call saying, I'm referring patient so-and-so to you because I'm not getting the results that I think they should get. There's a chiropractor in Raleigh, a neurosurgeon in Raleigh I work with. There's a neurosurgeon in Wilmington that I work with. There's orthopedic surgeons that I work with. So there are even times that I will pick up the phone and say, I think I need to refer you elsewhere. Or other health issues are coming up. And it's like, this is a medical problem. We need to send you back for medical testing.
So there are certain kinds of things that you see in your profession that are literally disease-based kinds of things that you don't want to go into, and you recognize that and do send people other places. I think the important thing here is often folks have the idea, well, you know, chiropractic, they're going to take on anything, they're going to just use me and what have you, but you do farm them out to other people if you don't feel that fits your form of medicine.
Definitely, I do. And all the Gray Bar Chiropractics, all 3 of our offices, yes, we do. We don't have a problem doing that at all.
Okay, we're going to take a break. We'll be back in a moment. We're talking with Dr. Mary Ann Luxter, and we're talking about chiropractic care that may help you. Ladies and gentlemen, welcome back. The name of the show is We Should Know. We're on the air with Star Vision TV also WCLN 1170 radio. Hope you're listening to us on the radio or viewing us on TV. You may be doing both if you're watching us and listening to us on Tuesday, 2:30 to 3:30 when the show airs. And if you are, you're seeing us and hearing us. But if you are hearing us, you may want to call a friend, or if you're watching us on TV, call a friend or a neighbor and say you want to look at this. There's a number of issues that relate to chiropractic care and the manipulation of the spine that we're talking about that may have an impact for you. We have a lot of doctors. We've had a number of medical doctors and specialists on the show as well. So if you happen to be listening, just keep in mind that we're looking at this specific area of medicine that works apparently for thousands of people because they see chiropractors every day. Dr. Marianne Luxer is with us. Marianne, again, thank you for being here. I know your schedule is extremely busy. You have a lot of stuff going on, a huge patient load. And I want to explain to our audience as we come back from break, when I have guests on, quite often it's because we get a high demand of folks calling in or emailing us to say, why don't you have more information about whatever subject? And as I just said, we've had everything from cardiologists, general practitioners, to orthopedic surgeons. In fact, Dr. Alex Huff is one of our sponsors of the show, and we try to have him on as much as his time will allow him. So it's important that folks understand that, and we're bringing you on to represent the chiropractic profession here in the area. So as we talk about that and think about the whole area of chiropractic care, does geography have a role to play in the kinds of patients you see? And I'm thinking primarily in the way folks go about their life and their lifestyle. Do you see more of certain kinds of things that you treat and deal with in certain areas of the state as opposed to other areas?
I would say yes, I do. Part of my education in Iowa was actually doing my internship with a chiropractor in an area similar to here in Clinton. And it's interesting how these patients that he would see and I would see there are similar to here because of the agricultural. I see a lot of low back issues, people who have issues from bending over or riding tractors. This time of year, I actually, earlier today, a patient was talking to me about how he's been sitting on his tractor and been doing a lot of twisting and turning. Another patient of mine actually calls it a tractor back because when he's on his tractor, he knows he's going to be having more low back pain. I also have a number of patients even from the company of Smithfield, and so they're doing a lot of bending and lifting. The other, as far as this area goes, when I'm actually from Ohio and from Northeast Ohio, so it's more industrialized. I would see a lot more office. When I was working in a chiropractic office prior to going to chiropractic school, it was a lot of issues of numbness in hands, issues with neck, and that's coming from sitting behind a desk. That's issues of dealing with hands on keyboards or bent necks on telephones and so forth. So there is some type of geographical per se as far as what the patient is going to present with.
One of the things that's interesting to me as well, you hear a lot of folks talk about surgery for carpal tunnel kinds of things, and I'm not even really sure what that means, but when you mentioned that, it just came to my mind that particular surgical procedure, do you get folks to come in that are working computers on a regular basis and they have numbness in hands or hand issues? Can you help that rather than automatically just going in for surgery? Is that something that can be helped through chiropractic care?
Yes, it can be, because the nerves that control your fingers actually originate in your neck. So the nerves, as they travel on down through the shoulder, through the elbow, through the wrist, and into your hands, you can get a pinch on that nerve in any one of those four areas. For example, when someone says they break their wrist, a wrist is not a part. It is a collection of 8 different bones that compose the wrist. And it's called a tunnel because of the curve or the placement that the wrists actually create is a tunnel where 2 nerves go through. So that's why it's called a carpal tunnel. So a lot of times people may have numbness in their hands, think that it's carpal tunnel, and actually it is degeneration of a disc in their neck that is causing the nerve to be becoming pinched and then numbness in their hands. Again, there's tests that can be done to find out exactly where that pinching is happening. So that's one way that I can help somebody who has carpal tunnel.
You know, one of the things that it was controversial a few years ago, in fact, back in 2003, 4, and 5, in that era, there was some confusion and concern. I use the word confusion, concern. I'll back that up and say concern about the radiology part of the X-rays that often, you know, folks in your profession use. Is there an excess amount of radiation used for you to be able to look at the spine? Are there other ways for you to look at the spine? Should people be concerned about that when they go see you and you start talking about spinal alignments and you're going to do an X-ray? Explain to us why they either should be or shouldn't be concerned.
They shouldn't be concerned at all. In fact, you're actually getting more radiation by sitting in front of a computer than what you would receive at a chiropractic office for an X-ray exam. By law, I have to take 2 views of a body part. You have to take a front view and a side view so that I get a 2-dimensional look at what is happening in someone's spine. So I keep it to a minimum, depending upon what that person presents with, as far as, do they have numbness in their hands? Do they have numbness in their feet? Then there are additional X-ray studies that can be done to find out exactly where the problem is coming from. So you don't need to be concerned about the X-rays. You're not getting any more exposure than what you would sitting in an office with multiple computers around you, or in a restaurant with microwaves going off. There's not a concern at all.
Is there a way, if somebody comes to see you and they present with certain kinds of ailments, can you deduce without X-ray to determine whether it's muscular or skeletal?
If it's skeletal, then I need the X-rays. If it's muscular, I can find that out just upon my exam and finding out from touching them where muscle spasms would be. Then I personally will not adjust a patient without X-rays. I feel that X-rays actually, you can find out disease processes by taking X-rays. I can find cancers. I can find other issues that are going on in someone's body that come out in an X-ray. So the X-ray just isn't there to find out where there's a misalignment in the vertebrae, but the X-ray is there also to find out as a diagnostic tool, as in a true cause for someone's pain.
How much does age, elderly and senior citizens that come to you, how much does age have to do with just the general breakdown of various skeletal or muscular tissues? Talk to us about that, because we have a huge population, as you well know, that are moving on into upper age. Of course, none of us fit that role, are moving on up into that bracket. Is there things you can do to help those folks that maybe you could tell them today on the show that maybe they need to think about not doing, or maybe something they should be doing?
Definitely. The interesting thing is there's no such thing as a low back pain gene. A lot of times someone will come into my office and say, well, my grandfather had issues, my father had issues, my mother had issues, but there's no such thing as that low back pain gene. What is transferred down through generations is how you deal with the problem. If you were taught to deal with the problem, just shake it off, keep moving, shake it off, keep moving, then you're going to inherit the same type of problems that were there in previous generations. But what I always like to concentrate on is, you know, we were born with a spine that was like a warm knife through butter. Everything was moving smooth. But then as we get injured, you know, 24 movable bones get out of alignment. And if you have a car that has a bad front end alignment, you're going to wear down those tires faster than if you didn't have problems in the front end. So your discs in your back, the only way for them to get fluid in your spine is through motion. But if you've got 2 vertebrae that are locked down, there's no fluid going into that disc, there's no motion there, it causes degeneration of that disc. The same thing with your brakes also. That front end alignment causes wear and tear on the brakes differently. The wear and tear on your joints is different also because of the misalignment in the vertebrae. So as you go through life, and as we all progress in life, then we're subject to that degeneration process because of bad posture, bad lack of exercise, bad eating habits, and everything else. So as we progress in age, you are subject to more issues, But had the problem been corrected earlier in someone's life, then those issues can be postponed that much farther.
So basically, what I hear you saying then, a sedentary lifestyle where you're not exercising, you're not going out and doing certain things and utilizing the structure, again, that God has given you, can result in negative impacts to your body.
Definitely. Definitely. A sedentary lifestyle is one of the worst lifestyles and one of the most popular lifestyles that causes back issues. We're designed to move. The bones of our body are there so that muscles have something to hang on to, because the muscles then provide the movement. If we're not moving through life, then we're not staying healthy. If we're not moving our legs, then the blood can't get pumped back to the heart as easy. Then we also have that downward pressure, putting pressure on the discs in our low back. If we're not moving and using our shoulders, then we now have shoulder issues, and we've got rounded shoulders, which creates a bad posture and forward head. So it all comes back into play as far as movement is what we're designed to do.
Very quickly before we go to our next break, I was reading an article some time ago in the past few months. A medical doctor had looked at standing versus sitting, and the statement was made, and I'll paraphrase, I can't quote it exactly, that the body is structured to be able to stand and move rather than sit. That sitting itself is not a good position for the body to be in.
It's the worst position that your body can be in. For one reason, we have three curves in our spine. From the front and back, the spine is supposed to be completely straight as your tie is. From the side, we're supposed to have three curves, one in the neck, one in the mid-back, and one in the low back. So those three curves are maintained better with standing.
We want to pick up that when we come back from break. We're talking with Dr. Mary Ann Luxter. We're talking about chiropractic care, maybe some things that might help you. Stay tuned. We'll be back in a moment. Ladies and gentlemen, welcome back. We Should Know is on the air. It's bringing you information and education about subjects, things, people you need to know about that may improve, assist in your life, in your lifestyle. I want to give a quick shout out to Boogie Shoes Radio Network on Saturday afternoon with Robert Stroud. All these folks mention our show on their show, so I like to call their names and make sure that you're watching. The Morning Crew with the L-Man, with Grandpa, Nolan Z, Wayne Weeks with the Gospel Hour, also Nicole for her wonderful introduction to this show each and every week, Tommy the Fly, The Country Store with Don Smith, very popular show that precedes this show airing on Tuesday, 2:30 to 3:30. We thank all of those folks for mentioning us and being part of what we're doing here as it relates to education and information. Today we're talking about chiropractic care with Dr. Mary Ann Luxter. Dr. Mary Ann Luxter, thank you again for being here. The show, as you've seen, goes kind of fast. There's a lot of things we want to talk about. Went to break, we were talking about standing versus sitting and the importance of for folks to understand that standing is important. And one of the things I've noticed lately, maybe we need to start that doing here, we need a different set, we could just stand, but the reality is that's a positive benefit exercise-wise. So would you recommend that to folks, to stand more than just sitting around casually watching, or even working on computers now? They have mobile stands.
They've got those mobile stands. You can even have something on a treadmill I've seen recently. I promote motion. Whatever gets someone to move is what I would want someone to do. There are some professions that you just can't move. Some professions, motion is not it. Or as you're traveling. I recently went on a trip with some friends of mine, and we made sure that every 100 miles, no matter where we were, we pulled over and we got out and we moved. We took the last parking spot and we walked into the convenience store to get whatever it was that we wanted to get. But it's motion, that sitting down. It's not just for chiropractic reasons, but it's all health in general. I mean, that's on an airplane. You're worried about issues of sitting in that cramped, confined place. So motion is necessary for that. It's movement that I'm a promoter of, not of any individual kind.
So if you had a slogan, it would be keep it moving.
Keep it moving.
Keep it moving. Let's go to the other end of the scale. We've talked about senior citizens. Let's talk about children. A lot of folks don't maybe see chiropractic and children as being something that kind of goes together. Do you see a lot of children?
I see a lot of children in my office. In fact, I'm very fortunate to be working for a chiropractor that allowed my dream to come true. In chiropractic school, I wanted to have a clinic that offered a kids clinic where parents didn't have to choose between a copay and getting chiropractic adjustments for children. So my boss, Dr. Michael Graybar, he has allowed me to have a free kids clinic in my office. What's interesting is the birth process is very traumatic. An infant is born with no neck muscle control, so their neck is moving around very freely. And as I said, it's motion that is necessary, but it's 24 movable bones. You have 7 within your neck alone. So those 7 bones, if the muscles are not strong enough to hold that position, then they're going to be moved out of alignment very quick and easy. So then babies end up getting a lot of ear infections. And the way the skull is, our jaws are longer as we get older, and so therefore the tubes that ears drain through are more horizontal than they are vertically. So children are prone to more ear infections than adults. That first bone right under the skull is where the brain stem is. And if it's out of alignment just a little bit, we're talking the pressure of 2 dimes on a nerve. Right now you and I are sitting here, and I'm going to mention that, do you feel your shirt on your back? It wasn't until I mentioned it that you actually feel the shirt on your back or the rings on your hands. But it's less pressure than that on a nerve that causes misfunction. So with infants, children, that first bone can put pressure on a nerve that can cause malfunction with problems with their stomach, pressure on a nerve. And a baby can't tell you, I have a sinus headache. That's all they're going to do is cry. And if we get them adjusted, we can get pressure off the nerve, then they can grow up and have, issues of childhood diseases can be lessened.
It sounds like to me, too, as I hear you talk, that it would be good for maybe folks to not only listen to this show, but to talk to you about the way they deal with children as parents. Because you create certain patterns, and some time back I asked somebody, I said, how did you parent? They said based on the way I was parenting. So they remember and they watch and they see other people holding children a certain way or holding a baby a certain way. Might not be the best procedure when you look at the skeletal structure of that child.
Yes, you're right. But then again, because they don't have the muscle control, you can't be, move the head, move the head, move. So they're going to create positions. You're not going to sit in the room and watch them in their crib. So that's why the children's clinic in the office is so important. And again, I don't have to use my hands on your child's neck or their low back. I have an instrument that gently taps motion into someone's spine. And I've got a patient right now that was seeing me for a colicky child. And after the first week of adjustments, the baby's almost sleeping through the night. And it was only a 2-week-old child.
How often do you get patients in your office that has that aha moment or that wow moment, and you do a specific adjustment, and all of a sudden they came in and they were maybe humped over, or you could see pain on their face, and you do some kind of procedure, and all of a sudden they're like, wow. Does that ever happen?
Yes, it does, and that is one of the rewards of my job, because it's not. They come in hunched over and in so much pain, and within a matter of minutes, I can give them the adjustment that they were looking for, and their bodies respond to it, and they get up and they're walking out. I've had patients come in walkers, on crutches, and leaving without. And it's not just my office. It's the chiropractic profession as a whole. And the interesting thing is, not knowing that I was going to go down this road, but chiropractic isn't just for humans. I have colleagues of mine that went to school and continued on, and they're giving adjustments to animals. They're giving adjustments to horses, to dogs, to cats. And those are my colleagues and friends of mine that I have. And the animal doesn't know a difference. They just, okay, you're going to help me with my shoulder. Race horses. I know of racehorse places that they have chiropractors on their payroll because of how chiropractic can help in a wide variety of ranges outside just the human frame.
I'm glad you mentioned that, because I didn't want to get into it, but I did some reading on animals and veterinarians and so forth as it relates to that. That seems to me to be a whole nother speciality if you would get into the veterinary side, because wouldn't the whole spinal structure be completely different?
Yes and no. The number of spines, this is a trivia question I give to all of my kids in my office. I always ask them, how many bones does a giraffe have in their neck? And they'll say 100. They'll say 50. I'll say, go home and Google it and come back and tell me. The answer is 7. They have the same number of bones as a human does in their neck. They're just quite a bit larger. But the frame is different. But the brain surrounded by a skull with the spinal cord surrounded by the spinal column is the same no matter what species it is of mammals. That's how God designed it, and that's how it is. Just as medical field has specialties. You mentioned Dr. Huff. Dr. Huff and I have worked together on a couple patients. I've been in surgery with Dr. Huff as he's done surgery on my patients. So they go to medical school and take a special courses to become that orthopedic surgeon or that neurosurgeon or that ophthalmologist. Chiropractic has the same specialties. A colleague of mine that I work with, he has a specialty of sports medicine. Then there is specialties in infant care. So chiropractic has their specialties as well, along with chiropractic care for animals.
Do you see a lot of people with vehicle accidents and various other accidents, whether it's vehicles or farm equipment or whatever? When those folks come in, are they covered under insurance? Just like if they went to a medical doctor,
yes,
the internal medicine?
Yes, they are. Their insurance will cover it as well. Their auto insurance will cover it as well. The thing that I want to mention to that is many people walk away from an auto accident thinking they weren't hurt. Well, you know, Sir Isaac Newton was the one that said everything stays in motion until an opposite and equal force is placed on it. So just because you walked away from an automobile accident doesn't mean you're not hurt on the inside. You may have walked away without a cut or bruising, but your head weighs the same as a gallon of milk. And if it came into contact going 50 miles an hour with that airbag, it had an equal force placed on it. Therefore, that impact then put 50 miles back into your neck and your spine. So your neck went back and then hit the rear seats or the headrest of the seat behind it. So there is internal damage with alignment issues of someone's spine.
Well, yeah, I'm just listening to that comment. It sounds to me as though you get involved a lot with athletics and as much football as we have in the area with football players and that kind of thing.
Dr. Graybar himself went to school on a sports scholarship. So we have another program in the office where I deal with the doctors in Clinton to get people back on the playing field. I come from Northeast Ohio where football is just as important. It's king. You know, Cleveland Browns, I'm sorry, I hope I don't get a boo on that one. But you know, the whole profession, the Football Hall of Fame, I grew up 20 minutes away from the Football Hall of Fame. So college scholarships are necessary for kids of today's and age because college is expensive. So my focus with student athletes is let's get them rehabilitated, let's get them back on the playing field so that they can continue to play because, you know, Friday Night Lights, it's important, and it's not just for football, it's for soccer, it's for cheerleading, it's for band and dancers in the area. Sports is a wide range and a scope of practice.
Kind of give you a few seconds here to wrap up, give you about 30 seconds. Anything that we missed or that you want to mention before we go off?
Chiropractic is important for everybody, and although chiropractic is a passion of mine, it became a passion of mine. And I always tell this to patients when they come into the office and they'll check the box that says, yes, they've been to another chiropractor. And it's like, you know, I'm not here to take you away from that chiropractor. If you're happy with the chiropractor that you're at, then by all means, then I want you to stay there and I want you to bring your family to that chiropractor because chiropractic is a profession that can help a wide variety. And every chiropractor has the education to help as many people as we possibly can. In the Graybar Chiropractic office, we have a lot of specialties that I think we can help a lot of people out.
Again, thank you for being with us, Dr. Mary Ann Luxter. We'll be back again next week, and I look forward to seeing you on the radio.
Thank you for tuning in to this week's episode of We Should Know with host J.W. Simmons. If you have a question or comment regarding this or any episode, please send your email questions and or comments to jwsimmonsedu@gmail.com. And remember to tune in every Tuesday afternoon beginning at 2:30 for another informative episode of We Should Know.